I'm delighted to be joined today by Dr. Declan Sheppard to tell us a little bit more about his innovation project and his experience with the Clinical Innovation Awards. Welcome, Dr. Sheppard. I'll allow you to introduce yourself first, please.
Okay, my name is Declan Sheppard. I am a interventional and diagnostic radiologist working in University Hospital in Galway.
Fantastic. Well, welcome and thank you for joining us to give us your thoughts today. First of all, thinking about your innovation, what was the clinical problem that you identified and how did you know that this was a problem?
Okay, as part of my role as an interventional radiologist, we were seeing a lot of patients coming down for peripherally inserted central cancer, so-called PICC lines. Okay, and this was due to the fact that patients had had multiple attempts at vascular access performed on the wards, often unsuccessfully. Okay, and they would come down for these PICC lines because of very poor vascular access. So it just struck me that perhaps there was an issue going on the wards that was meaning that we were seeing a lot of these patients unnecessarily. And I just wondered if it might be possible to do something to improve vascular access, particularly on the wards or down in ED, but outside the radiology department.
So that solution then you came up to, what was the solution that you identified to this problem?
Okay, so the solution is that, there are lots of ultrasound machines around the hospital, small kind of laptop-based ones and mobile systems, but they're not all that mobile. So I was wondering if we could have something that was based around a mobile phone. So what I've tried to develop is a mobile phone-based ultrasound system that is very specifically tailored for vascular access. There are lots of point-of-care ultrasound machines, some of which are connected either by wire to a mobile phone or wirelessly. But the issue is that some of these are very, very bulky. They're also very expensive. And I just wondered if we could develop something that was slightly cheaper, okay, very dedicated for vascular access, and which could be used by doctors and nurses on the wards to improve their vascular access patients for cannulas.
Great. So if you had an idea, if someone else has an idea, is working clinically and wants to apply, can you tell us a little bit about your experience applying for the Clinical Innovation Award and what that was going to allow you to do?
Okay, so it all started about 3 years ago. I had this idea and I got a health an assessment done of the technology assessment done through the Health Innovation Hub in University Hospital in Galway. And, it looked kind of promising. The only problem at the time was that there were lots of various connectors for phones in terms of Lightning connectors and USB connectors. And it just looked a bit too complicated at the time. What changed was about a year ago, the EU decided that all phones going forward would be based around USB-C connectors. So when I saw that, I thought, maybe there'd be a chance to look at this again. And on that basis, then the Clinical Innovation Awards were coming up around this time last year, around August, September. And I started to put the original technology assessment together, and we put an application in for a Clinical Innovation Award, which ultimately we were successful in.
You were successful in 2023. Did you find the application process fairly straightforward? Is there any hints or clues you could give someone who's tackling that application?
Yeah, I must say the big thing was that Steve Griffin had done that the technology assessment for me. So I must say I found that extremely useful. Okay, when I was applying now, when I actually went to do the application, it was very, very straightforward. But I must say that technology assessment kind of put it, in terms of the areas that I need to address as part of the application had been very well addressed. I need to obviously pad them out a tiny bit, but I must say the actual application was very, very easy.
Great. So as you said, it was Steve Griffin who was manager of the Health Innovation Hub in Galway. So prior to your application, and anybody that does apply can obviously get the assistance of any of our national hubs. We have one in Cork and in Dublin for any assistance with the programme. So thank you for that. As part of the award winner for the Clinical Innovation Awards, you were also offered the Clinical Entrepreneur Programme in the NHS. Can you tell us a little bit about that opportunity?
Yeah, that has absolutely been great. And essentially, they have a whole lot of so-called pit stops. So there are 8 in total. And what they have done is they have covered a whole lot of areas. I'm a clinician. I do not have a background in engineering. I do not have a background in product development, in marketing, in IP, in terms of building teams. But essentially what the NHS program has is, they've had a whole session on IP, they've had a session on marketing, they have had a session on kind of team building. So I found it extremely helpful in terms of just addressing those areas that some of which at the NHS things, a lot of the groups are maybe a year, 2 years ahead of where I am, probably even more. But it's actually a very useful exercise to start at least thinking about some of the issues around clinical entrepreneurship that may not come naturally to, but certainly the one thing that happens during the sessions is they have these so-called pioneers. There are people who have gone through the program in the past, and they're extremely good. They're also very frankly honest, and they are very good at kind of pointing out the various hiccups and points. So there was certainly one session early on around IP and just about what not to do. So I must say the honesty of some of the pioneers has been very instructive, and certainly as one of the sidelines from the Clinical Innovation Award to get that opportunity to go in the NHS has been extremely helpful, and lots and lots of contacts made and kind of people that you can touch base with, going forward, particularly outside Ireland.
Great. So as the message there then, that as a clinician with the idea and being at the forefront of finding the problems and maybe identifying the solution, you don't have to be a business person to start this out. So that journey towards commercialization, you're being supported along that journey through both the Clinical Innovation Award process and the support you're getting from technical experts into the NHS and the Clinical Entrepreneur Programme, where you're then having the expertise of a wider range of people and linking in with these pioneers, as you mentioned. So thank you for outlining that. So if we can come back to your own innovation, how have you progressed your solution, and what are the next steps for you now, Dr. Sheppard?
The first thing we did, following some discussion with some people within the university, was we sorted out the intellectual property. On the basis that if all of the IP and the patents were all tied up, probably this wasn't going to be feasible. And also in terms of what's referred to as freedom to operate. So we did the IP reasonably early on, and that was very useful because it showed that there were no major issues from an IP perspective. Then, as part of the Clinical Innovation Awards, there's a certain amount of money comes with that, which is about 15,000. Which after VAT is about 12.5. And what we've done there is we have gone out actually to the same company who did the IP evaluation to do market analysis. Because the problem is that you need to. It's all very well to develop a product or a service. It needs to be marketable. It needs to pay for itself. So what we've gone out primarily is to the US market, and this relates to I've done some work in the past with BioInnovate within the University of Galway, and one of the issues that arose in the past was that there were no insurance codes, for example, for something that we were trying to develop a couple of years ago. And essentially, without any insurance code, nobody's going to pay for this. And then ultimately, you're not going to be able to get investors in. So literally about 3 weeks ago, we started the market analysis. We've had a follow-up meeting, and they've gone off to people in the US just to see if the product as we propose is viable. Is there a market for it? Will somebody pay for it ultimately? And then based on that, we'll try and develop the product. Now, within the university, I've had other meetings. So I actually had a meeting this morning with one of the engineers, and I've also had meetings with some people within Martin O'Halloran's group, Owen and Marcin. And what we're looking now is we're getting down to the technicalities of how we might develop our ultrasound device. So we're working through that at the moment. We're hoping that we might have a very clunky but kind of workable model by the end of the year. The one thing I'd say to anybody who's involved with this program is it takes a lot longer than you think. Everything seems to take time. But I think what you need to, as I was speaking to Emer last week, I think a more structured system in terms of as people come onto this program, in terms of what are the useful steps. And while the NHS, the clinical entrepreneurship course is very good, I think there needs to be some input from Ireland. It's slightly different, but in terms of how you kind of develop your idea, how you progress it, and then in terms of lining up support to either within the industry or particularly within the universities, just to kind of steer you towards possible solutions. And then what we're looking at is if we can develop, if the IP, we know the IP is okay, if the market analysis is okay, if we can develop a kind of a working model, it won't be particularly pretty. What we would then be doing is looking for commercial funding, so-called COM funding, going forward, because as was discussed at the meeting this morning, is none of these things come cheap, and there will be certainly a requirement for money to allow us to develop both the initial model and then subsequent versions of it.
That's great advice for people coming in, and thank you for that. I suppose you mentioned that these projects take time. How do you find balancing your own time and taking on a project like this?
I'm so busy clinically. I literally, at the moment I have clinical commitments 4.5 out of 5 days a week. So I literally have, as we're talking on a Friday morning, and it's not even every Friday morning, it's my only free time for this kind of development. So it is difficult, because the problem is that while I could in the past I would have done stuff out of hours or over at weekends, the problem is I need to speak to people during normal working hours when they're working. So it is difficult, and but you have to be quite focused. So literally now the meeting we had today was one of the meetings we had today was planned 3 weeks ago. So I literally you need to kind of work out what are the steps. And the problem is, as we found out over July and August during the summer holidays, was it's very easy for these things to slip. So literally this morning now was a reboot to try and get things going again. So hopefully now that we're all kind of back to work in September, I'll try and keep this kind of going forward now, certainly up to, and hope I have specific targets that I would like to get addressed before the end of the year.
Well, best of luck to you on that. So finally, on the advice again, so you've said to people to stay focused and to keep going, because these things take time. Is there any other final advice you'd give to anybody in the health service to apply?
Yeah, I think clinical innovation in all its forms is extremely useful. Okay, it's useful for a whole lot of reasons. Okay, one, it's useful for patient care. Ultimately, that's why we're here. We're here to look after patients. On a kind of personal level, it's great because it keeps you up to date. It keeps you motivated. It's something different from day-to-day work. And certainly, between the Enterprise Ireland and between the NHS program, it's delving into areas that there are things that I can learn from that I can transfer back into my practice. But it also it's interpersonal development. I think it's extremely useful, and there are people out there with great, and some of the things we've seen in the NHS, they're very, very simple ideas, but they can have a very, very significant impact on patient care. And for those people out there who and it's not just doctors, it's nurses, it's physios, occupational therapists, radiographers, across the board, you all have something to contribute. Okay, and if you do have something to contribute, certainly through this program, there are opportunities and some money to allow you to try and develop some of these things. And certainly the other thing is reach out to the health innovation hubs, reach out to people within the universities. There is support out there, and I must say the contacts I've had to date people have bent over backwards to be helpful. So don't ever get discouraged.
Dr. Declan Sheppard, it's been a pleasure talking to you today, and thank you very much.
No problems. Thank you very much.